Diabetes is a chronic condition that affects millions of people worldwide. It occurs when the body either doesn't produce enough insulin or can't effectively use the insulin it produces, leading to high levels of sugar in the blood. If left untreated or poorly managed, diabetes can result in serious complications such as heart disease, stroke, kidney failure, nerve damage, and vision loss. Recognizing the symptoms of diabetes is crucial for early detection and prompt treatment. In this comprehensive guide, we will delve into the various signs and symptoms of diabetes, the different types of diabetes, risk factors, and the importance of seeking medical attention for proper diagnosis and management. Understanding diabetes. Diabetes is a metabolic disorder characterized by elevated levels of glucose in the blood. Glucose is the primary source of energy for the body's cells and is derived from the foods we eat. Insulin, a hormone produced by the pancreas, helps regulate blood sugar levels by facilitating the uptake of glucose into cells for energy production or storage. There are three main types of diabetes. Type 1 diabetes. This type of diabetes occurs when the immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. As a result, the body produces little to no insulin. Type 1 diabetes is typically diagnosed in children and young adults, although it can occur at any age. People with type 1 diabetes require lifelong insulin therapy to manage their blood sugar levels. Type 2 diabetes. Type 2 diabetes develops when the body becomes resistant to insulin or fails to produce enough insulin to meet its needs. This type of diabetes is more common than type 1 and is often associated with lifestyle factors such as obesity, sedentary lifestyle, and poor dietary habits. While type 2 diabetes can develop at any age, it is more prevalent in adults, especially those over the age of 45. Initially, the pancreas may produce extra insulin to compensate for insulin resistance, but over time, it may become unable to keep blood sugar levels within the normal range. Gestational diabetes. Gestational diabetes occurs during pregnancy and is characterized by high blood sugar levels that develop during pregnancy in women who did not previously have diabetes. While gestational diabetes typically resolves after childbirth, it increases the risk of complications for both the mother and the baby, including preeclampsia, large birth weight, and type 2 diabetes later in life. Symptoms of diabetes. Recognizing the symptoms of diabetes is essential for early detection and timely intervention. While the signs and symptoms may vary depending on the type of diabetes and individual factors, common symptoms include increased thirst and frequent urination, excessive thirst, polydipsia, and frequent urination, polyuria, are hallmark symptoms of diabetes. When blood sugar levels are high, the kidneys work overtime to filter and absorb excess glucose, leading to increased urine production. This can result in dehydration, prompting increased thirst to replenish lost fluids. Unexplained weight loss. Sudden and unexplained weight loss, despite increased appetite and food intake, can be a warning sign of diabetes, particularly type 1 diabetes. When the body is unable to use glucose for energy due to insulin deficiency, it starts burning fat and muscle tissue for fuel, resulting in weight loss. Fatigue and weakness. Persistent fatigue and weakness are common symptoms of diabetes, as high blood sugar levels can impair the body's ability to utilize glucose for energy effectively. In addition, inadequate insulin or insulin resistance can lead to cellular starvation, causing fatigue and lethargy. Blurred vision. High blood sugar levels can cause changes in the shape of the lens in the eye, leading to blurred vision. This symptom may improve once blood sugar levels are brought under control, but it is important not to ignore it, as untreated diabetes can lead to long-term vision problems and even blindness. Slow wound healing. Diabetes can impair the body's ability to heal wounds and injuries due to poor circulation and compromised immune function. Minor cuts, bruises, or infections may take longer to heal in individuals with diabetes, increasing the risk of complications such as infections and ulcers. Tingling or numbness in hands and feet. Nerve damage, neuropathy, is a common complication of diabetes that can cause tingling, numbness, or burning sensations, particularly in the hands and feet. This condition, known as peripheral neuropathy, can also result in loss of sensation, making it difficult to detect injuries or infections. Recurrent infections. High blood sugar levels can weaken the immune system, making individuals with diabetes more susceptible to infections, particularly urinary tract infections, yeast infections, thrush, and skin infections. Recurrent or persistent infections may be a sign of underlying diabetes and should prompt further evaluation. Increased hunger. Despite eating regular meals, individuals with diabetes may experience persistent hunger, polyphagia, due to the body's inability to utilize glucose efficiently for energy. This can lead to overeating and weight gain, exacerbating the symptoms of diabetes. Dry mouth and skin. Dehydration resulting from increased urination can cause dry mouth and dry, itchy skin in individuals with diabetes. Poor blood sugar control can also affect the body's ability to maintain proper hydration and skin health, leading to dryness and discomfort. Erectile dysfunction. Men with diabetes may experience erectile dysfunction, impotence, due to nerve damage and impaired blood flow to the penis. Diabetes-related complications such as neuropathy and vascular disease can contribute to sexual dysfunction, affecting both physical and emotional well-being. It is important to note that not everyone with diabetes will experience all of these symptoms, and some individuals may not experience any symptoms at all, especially in the early stages of the disease. Additionally, the severity and progression of symptoms may vary depending on individual factors such as age, overall health, and degree of blood sugar control. Risk factors for diabetes. While the exact cause of diabetes is not fully understood, several factors can increase the risk of developing the disease. These risk factors include family history. A family history of diabetes, particularly in first-degree relatives, parents, or siblings, increases the risk of developing diabetes, indicating a genetic predisposition to the disease. Obesity. Excess body weight, especially abdominal obesity, is a significant risk factor for type 2 diabetes. Obesity is associated with insulin resistance and inflammation, contributing to the development of diabetes and other metabolic disorders. Sedentary lifestyle, lack of physical activity, and sedentary behavior are major risk factors for type 2 diabetes. Regular exercise helps improve insulin sensitivity, promote weight loss, and reduce the risk of developing diabetes and its complications. Unhealthy diet. A diet high in processed foods, refined carbohydrates, sugary beverages, and saturated fats can increase the risk of obesity, insulin resistance, and type 2 diabetes. Conversely, a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help prevent diabetes and promote overall health. Age. The risk of developing type 2 diabetes increases with age, particularly after the age of 45. Aging is associated with decreased insulin sensitivity and beta cell function, making older adults more susceptible to diabetes. Ethnicity. Certain ethnic groups, including African Americans, Hispanic/Latino Americans, Native Americans, Asian Americans, and Pacific Islanders, have a higher prevalence of diabetes compared to the general. Diabetes is a chronic condition characterized by high blood sugar levels either due to insufficient insulin production as with type 1 diabetes, or the body's inability to effectively use insulin as with type 2 diabetes. While conventional treatments such as medication and insulin therapy are essential for managing diabetes, many individuals also explore natural remedies as adjunctive therapies to help control blood sugar levels and improve overall health. Today, we'll explore some evidence-based natural remedies that may aid in managing diabetes. Dietary changes. One of the most powerful tools for managing diabetes naturally is making dietary changes. Focus on incorporating foods that have a low glycemic index and are rich in fiber, healthy fats, and lean proteins. Some dietary strategies include high-fiber foods. Fiber slows down the absorption of sugar into the bloodstream, helping to stabilize blood sugar levels. Include plenty of fruits, vegetables, whole grains, legumes, and nuts in your diet. Healthy fats. Incorporate sources of healthy fats such as avocados, nuts, seeds, and olive oil into your meals. These fats help improve insulin sensitivity and promote satiety. Limit refined carbohydrates. Minimize consumption of sugary snacks, white bread, pasta, and processed foods, which can cause blood sugar spikes. Portion control. Pay attention to portion sizes and aim for balanced meals to prevent overeating and promote weight management. Regular exercise. Physical activity plays a crucial role in managing diabetes by improving insulin sensitivity, lowering blood sugar levels, and supporting overall health. Aim for at least 150 minutes of moderate intensity aerobic exercise per week, along with strength training exercises 2 or more days per week. Find activities you enjoy, such as walking, cycling, swimming, or yoga, and incorporate them into your daily routine. Herbal supplements. Several herbs and botanicals have been studied for their potential benefits in managing diabetes. While more research is needed to confirm their efficacy, some herbs that show promise include cinnamon. Some studies suggest that cinnamon may help improve insulin sensitivity and lower blood sugar levels. Sprinkle cinnamon on foods or brew cinnamon tea to incorporate it into your diet. Ginseng. Korean red ginseng and American ginseng have been studied for their potential to improve insulin sensitivity and lower blood sugar levels in people with diabetes. Fenugreek. Fenugreek seeds are rich in soluble fiber, which can help lower blood sugar levels. You can consume fenugreek seeds whole, ground, or as a supplement. Stress management. Chronic stress can contribute to insulin resistance and elevated blood sugar levels.